So there are many patients in hospital who are at risk of a fall or a risk of an aspiration. This is an extra pair of eyes to help our nurses to monitor patients who need the surveillance the most. It's a portable camera that you can wheel into the room of a patient who's at a high risk of an adverse event, whether that's a fall or whether it's, say, oxygen coming out of the patient's nose. The attendant can actually redirect the patient, and if they don't respond, there's a direct line to the charge nurse who can then intervene before there's any further clinical deterioration. The video feed is being monitored by a virtual attendant and can monitor up to 12 patients at one time.
The camera would be placed in a way where we'd be able to see both the patient and the monitors that they have beside them, such as their high flow oxygen levels. We can move the camera around to not only just observe the patient, but also room setting to see if nurses are around, if patients' family members are around, to give them privacy.
So we had a pilot on our pulmonary ward here at the University Hospital for about 3 years, and over that time we monitored over 18,000 patient hours. We actually detected over 500 episodes of patients inadvertently taking their oxygen off. And so by intervening on that quickly, we actually reduced the number of ICU transfers on the unit, the number of deaths on the unit, and also we found that falls on the unit fell significantly for patients who were monitored because they had someone giving an extra pair of eyes to them.
There you go, Daddy.
My dad was diagnosed with Lewy body dementia. He used to wander a lot. They had to use so many staff to keep an eye on him that the camera kind of eased that. It's made it easier for me to sleep at night. It's made it easier for the nurses. It's just made it easier all around for everybody.
It feels good because we've been helpful to a patient, and knowing that you changed someone's life or saved them from something, it's nice to be there for somebody and making sure that they feel safe and their families feel protected.
Once we saw the benefits of it, this is why we've now expanded to general internal medicine. We're going to cardiology next month. We're also later going to be going to neurology as well as geriatrics. So we see that there's a lot of patient populations that can really benefit from an extra pair of eyes.